Assisted Reproductive Technologies and Genetic Disorders, Screening and Prevention. Title: Assisted Reproductive Technologies and Genetic Disorders, Screening and Prevention. Introduction. Assisted reproductive technologies, ART, have revolutionized the field of reproductive medicine, offering hope to many couples struggling with infertility. However, along with the benefits, there are concerns regarding the potential for the transmission of genetic disorders to future generations. This article explores the importance of screening and prevention strategies in ART to mitigate the risk of passing on genetic disorders. Understanding genetic disorders. Genetic disorders are medical conditions caused by alterations or abnormalities in an individual's genetic material. These conditions can range from mild to severe, and they can affect various aspects of a person's health and development. While some genetic disorders are inherited from one or both parents, others occur spontaneously due to genetic mutations. These techniques offer opportunities to identify and prevent the transmission of genetic disorders in several ways. 1. Preconception genetic counseling. Preconception genetic counseling is the first step in ART for couples at risk of transmitting genetic disorders. This counseling involves a thorough assessment of the couple's medical history, family history, and existing genetic conditions. Genetic counselors play a crucial role in providing information, education, and guidance to couples, helping them make informed decisions about their reproductive options. 2. Carrier screening. One of the most effective strategies in preventing the transmission of genetic disorders is carrier screening. Carrier screening involves testing individuals for gene mutations associated with specific disorders, even if they do not exhibit any symptoms. By identifying carriers of genetic disorders, couples can make informed decisions about ART treatment options, such as selecting a donor or pursuing preimplantation genetic testing. 3. Preimplantation genetic testing. Preimplantation genetic testing, PGT, is a powerful tool that enables the screening of embryos for genetic disorders before they are implanted in the uterus. There are two types of PGT: preimplantation genetic diagnosis, PGD, and preimplantation genetic screening, PGS. PGD involves testing embryos for specific genetic disorders known to be present in the family. This technique allows for the selection of embryos that are free from the tested disorder, reducing the risk of passing it on to offspring. On the other hand, PGS screens embryos for chromosomal abnormalities, such as aneuploidy. This testing is particularly beneficial for couples with a history of repeated pregnancy loss or advanced maternal age, as it improves the chances of a successful pregnancy. 4. Non-invasive prenatal testing, NIPT. Non-invasive prenatal testing, NIPT, is a revolutionary technique that screens for chromosomal abnormalities in a developing fetus. This test involves analyzing cell-free fetal DNA obtained from a maternal blood sample. NIPT can detect conditions such as Down syndrome, trisomy 18, and trisomy 13 with a high degree of accuracy. Early detection of these conditions allows couples to make informed decisions regarding the continuation of the pregnancy and appropriate medical interventions. 5. Ethical considerations. As with any medical intervention, there are ethical considerations surrounding the use of ART for screening and preventing genetic disorders. Issues such as the potential for genetic discrimination, The selection of embryos for non-medical reasons, and the long-term consequences of manipulating human embryos must be carefully addressed. Societal discussions, legislation, and guidelines should aim to strike a balance between promoting reproductive autonomy and safeguarding the rights and well-being of future generations. As the field of assisted reproductive technologies, ART, continues to advance, it is crucial to prioritize the screening and prevention of genetic disorders. This article explores the importance of various strategies in mitigating the risk of passing on these disorders. Preconception genetic counseling serves as the first step in ART for couples who may be at risk of transmitting genetic disorders. Another effective strategy is carrier screening, which involves testing individuals for gene mutations associated with specific disorders, even if they do not exhibit any symptoms. Identifying RS allows couples to make informed decisions about ART treatment options and select a donor or pursue pre-implantation genetic testing. Pre-implantation genetic testing, PGT, is a powerful tool in preventing the transmission of genetic disorders. It involves screening embryos for specific genetic disorders before implantation. This technique allows for the selection of embryos that are free from the tested disorder, reducing the risk of passing it on to offspring. PGT also includes pre-implantation genetic screening, PGS, which screens embryos for chromosomal abnormalities, benefiting couples with a history of repeated pregnancy loss or advanced maternal age. Non-invasive prenatal testing, NIPT, is a groundbreaking technique that screens for chromosomal abnormalities in developing fetuses. It is essential to address ethical considerations associated with ART and genetic screening. Discussions surrounding potential genetic discrimination, the selection of embryos for non-medical reasons, and the long-term consequences of manipulating human embryos are crucial. Societal discussions, legislation, and guidelines should aim to strike a balance between promoting reproductive autonomy and safeguarding the rights and well-being of future generations. Continued. Furthermore, advancements in the field of ART and genetic screening continue to push the boundaries of what is possible. New techniques and technologies are continually being developed to improve the accuracy and effectiveness of genetic screening and prevention. This collaborative effort will ultimately lead to more effective screening methods and improved outcomes for couples undergoing ART. The importance of public awareness and education should not be underestimated. By raising awareness about the potential risks and benefits of ART and genetic screening, individuals and couples can make informed decisions about their reproductive options. As the field of assisted reproductive technologies, ART, continues to progress, it is important to emphasize the significance of screening and prevention when it comes to genetic disorders. This article delves into the importance of various strategies that can help mitigate the risk of passing on these disorders. One of the initial steps in ART is preconception genetic counseling, which is designed for couples who may be at risk of transmitting genetic disorders. Genetic counselors assess a couple's medical and family history, as well as existing genetic conditions, in order to provide key information and guidance. This enables couples to make informed decisions regarding their reproductive options. Carrier screening is another effective strategy that involves testing individuals for gene mutations associated with specific disorders. Even if carriers do not display any symptoms, identifying them helps couples make informed decisions about ART treatments. This can include selecting a donor or pursuing pre-implantation genetic testing. Pre-implantation genetic testing, PGT, is a powerful tool in preventing the transmission of genetic disorders. Embryos are screened for specific genetic disorders before they are implanted, allowing couples to select embryos that are free from the tested disorder. This significantly reduces the risk of passing on the disorder to their offspring. Non-invasive prenatal testing, NIPT, is a groundbreaking technique that screens for chromosomal abnormalities in developing fetuses. This test involves analyzing cell-free fetal DNA obtained from a